What is the sweat chloride test for CF diagnosis? Imagine a simple test that can help doctors find out if someone has cystic fibrosis, a condition that affects how salt moves in the body. That test is called the sweat chloride test. It works by measuring the amount of chloride, which is a type of salt, in a person's sweat. People with cystic fibrosis tend to have higher levels of chloride in their sweat because of a problem with a specific protein called the CFTR protein. This protein helps control salt and water movement in the body, and when it doesn't work right, salt transport gets disrupted. Here's how the test is done. A small area of skin, usually on the forearm, is prepared. A gentle electrical current combined with a chemical called pilocarpine is applied to stimulate sweat production. This process takes about 30 to 60 minutes. The sweat produced is collected using a special device, and then its chloride level is measured in millimoles per liter. The results help doctors understand whether the salt levels are normal or elevated. Interpreting the results is straightforward but important. If the chloride level is less than or equal to 29 millimoles per liter, cystic fibrosis is unlikely. If the level falls between 30 and 59 millimoles per liter, the results are considered borderline, and further testing like repeat sweat tests or genetic analysis may be needed. When the chloride level reaches 60 millimoles per liter or higher, it strongly indicates the presence of cystic fibrosis. These cutoffs can vary slightly depending on age, especially for infants under 6 months, but generally, high levels point to the disease. This test is usually performed after a positive newborn screening or when symptoms suggest CF, such as persistent cough, poor growth, or salty tasting skin. It is safe, non-invasive, and painless, although the electrical stimulation might cause a mild tingling sensation. The test is most reliable when done correctly by trained healthcare professionals. Sweat chloride levels tend to stay consistent over time and are not affected by common illnesses like colds. However, in rare cases, other medical conditions such as hypothyroidism or Addison disease can cause elevated sweat chloride, so doctors consider the full clinical picture and may order additional tests if needed. Overall, the sweat chloride test is a key tool in diagnosing cystic fibrosis. It provides valuable information about how salt is transported in the body, helping doctors confirm or rule out the condition. While it is a reliable and widely used test, sometimes borderline results requiring further investigation with genetic testing or other specialized procedures. If you or your child are being tested, remember that this process is safe and designed to give clear answers to guide treatment and care. Always consult healthcare professionals for personalized advice and diagnosis.